Hi, this is Dr. Susan Sarajari from Dominion Fertility. Thank you so much for joining me here today. I just wanted to talk to you a little bit about the importance of medical records if patients already had fertility evaluation or treatment at another center. In fact, here at Dominion Fertility, we see many patients who have already had a fertility evaluation or fertility treatment with another provider or at another clinic. And so it's really important for them to bring their medical records with them so that we can review them. We do review them actually very closely, and a lot of times we're able to find information which sometimes the patient wasn't aware of. For example, I recently had a patient who had a fertility evaluation at another clinic, and we found that she had some abnormalities on her HSG, which is the hysterosalpingogram, which evaluates the fallopian tubes. And so the patient was very surprised to find that out, and for some reason or another it hadn't been communicated to her by the other clinic. In addition to that, it's also really important to look at the records if you want to make a management plan, meaning, for example, if a patient wants to do an intrauterine insemination or an IUI, it's really important that you look at the HSG and you make sure that the tubes are actually open and that the semen analysis is actually adequate for an IUI to be successful. Likewise, if somebody wants to do IVF, it's really important, for example, that there is no fluid in the tubes by HSG, which is called the hydrosalpinx, and which can essentially reduce success rates by 50%. So that way it's really, really important to have those records available and be able to review them. In addition to that, it also helps you make a management plan. For example, if patients had fertility treatment elsewhere, we can look at that treatment and we can see what was done and what medications were given, and we can see if we can improve upon that or do a different treatment to be more successful. So really, whenever a fertility evaluation was done elsewhere or a patient had treatment elsewhere, it's really important to bring your records so that we can review them, make an appropriate management plan for you, and get you pregnant the fastest way possible. Thanks so much for joining me. I'm Dr. Susan Sarajari from Dominion Fertility.
Dominion Fertility, making miracles happen, one family at a time.